Hello, Dr. Evangelos Milonas at Kinetic Health. We'll be assessing the big toe, or the first toe. Looking at the big toe, we'll have to consider the anatomy. And this is a very important structure in terms of gait. When you're pushing off, you need this big toe to be flexible yet rigid. And there is a condition that we'll see once in a while, which is Hallux rigidus. It's basically a condition where the big toe becomes very stiff and inflexible, achy and painful. And if that happens, it's not a very effective lever when you're pushing off. So in order to assess it, you want to look at two joints. The first joint being the metatarsophalangeal joint, which is the MTP joint. This is the metatarsal, and this is the first phalanx here. And so basically it's the joint between the two bones. You want to assess it in extension, bringing the toe back, in flexion, pulling it down and forward, abduction, which is bringing it outwards, and also adduction, pushing it inwards. And one thing you don't want to miss is the rotational component. So you want to make sure you're grabbing the toe and turning it in as well as turning it out, creating some rotation there. The second joint now is a little bit further down. It's the tip of the big toe and the bone in the middle, the phalanx. And basically you're taking the tip once again. You want to lock out the rest of the toe and just make sure the tip is coming forward, that you're able to push it back into extension, outwards into abduction, inwards into adduction, and once again the rotational component. And so definitely make sure you're assessing both joints. You want to look at the function of the big toe. It's quite important in gait, and it can add to a lot of different conditions and problems if it's not functioning.